The nonprofit called Maine Family Planning was founded more than 50 years ago. It gives access to the full range of sexual and reproductive health services, regardless of a patient's ability to pay. Funding for the organization and others like it is often met with resistance, as many associate it strictly with abortion care. But Maine Family Planning says at its more than 50 clinical sites last year, it served nearly 36,000 people. Good evening. Thanks for joining us here on News Center Maine at 5:30. I'm Zach Blanchard. Chris Costa is off tonight. In order for nonprofits like Maine Family Planning to run, they need funding. And in Augusta today, lawmakers are considering a reproductive care bill that would give them that funding. News Center Maine's David Guilford has the details from the State House.
As this legislative session neared its end, some healthcare providers held out hope that funding they believe is critical would pass before the deadline.
It's totally self-contained, so we can go anywhere.
This is the latest tool for Maine Family Planning, a rolling clinic aimed at reaching rural, underserved communities for sexual and reproductive care.
Is that there are folks who have been treated badly by the healthcare system. They've been stigmatized. Folks who experience opioid use disorder, folks who are without housing.
George Hill leads the organization, which gets federal funding. A current bill, LD 1478, would set aside $3+ million in state general funds each year for family planning resources like this.
Contraceptive care, sexually transmitted infection, screening, treatment, and diagnosis.
Hill said public funding has been stagnant for 10 years, leaving most of their rural brick-and-mortar offices open once a week.
Planned Parenthood should fund it through their billions or private resources.
Republican Representative Michael Lemlin said family planning groups like Planned Parenthood make enough money and should support themselves and each other. At least part of that stance is because family planning can include abortion care. The bill's supporters and Hill said the funds wouldn't cover abortion care. Lemlin said his party doesn't buy it.
We don't believe them and wouldn't, even if they put it in writing.
While in favor of abortion care access, Hill said instead of that one area of care, this funding would mean this truck could reach more Mainers for other critical, potentially life-saving care they might otherwise not get.
They need a regular health care provider, and this is one way to do that.
Proponents here were optimistic this bill would hit the floor for a vote before the session ended, while Lemlin doubted that. In Augusta, David Guilford, News Center, Maine.
And we should note that just last week, lawmakers censured Representative Michael Lemlin, who you just heard from. The Republican lawmaker implied the Lewiston mass shootings were a punishment from God for expanding abortion access in Maine.